told you, of course, the Permanent Secretary in the Ministry of Health, Helen Roy, get the impression will be presenting this evening. In the room, I see Irving Paul, the GIS, the Casualty, the Reconstruction, and a number of reporters in the room this evening. So we're about to bring you coverage of this press conference. Dr. Colin McIntyre is also sitting at the table, and we're about to bring you this press briefing, the 6th day of efforts here in Dominica to bring the country to normalcy. Do we go across to the Prime Minister? Is he ready? We'll find out whether the Prime Minister is ready. He tells me he's ready. Over now to the Prime Minister.
Thank you, Mr. Moderator. But let me greet all of you. Good evening. I want to always specifically recognize the media for being here, the press, for being here as you play a part in the dissemination of information to the wider public. Let me also greet everyone who is listening or viewing this live broadcast of yet another briefing on the developments since the passage of Tropical Storm Erica. We have with us this evening, and tonight's media briefing will focus on health and health issues as they relate to the Tropical Storm Erica. Mrs. Helen Johnson. We have the Dr. Blah. We have Mrs. Augustine, who is the PAHO Dominica rep, present, and we have the Director of Primary Health Care, Dr. Esprit, here. I believe that's the team that has been working collaboratively with other health stakeholders to effect the state's response to the challenges which we have been facing as a result of the passage of Tropical Storm Erica. So the questions you have tonight, please direct them to the health team. As far as possible, I will be mainly sitting on the sidelines. But I would like to make, before I pass on to Mrs. Roy, the Permanent Secretary, who shall chair the press briefing this evening, I wish to make a couple quick points to speak to a couple matters and to inform you, the press, and of course the wider public. As you know, the government has taken a decision to declare Thursday, September 3rd and Friday, September 4th, 2015 as National Days of Mourning in the wake of the devastation caused by Tropical Storm Erica. As a result, all flags shall be flown at half-staff on all public buildings on both days. Also address the nation on Thursday, September 3rd, 2015. National Days of Prayer shall be held on Saturday, September 5th and Sunday, September 6th, 2015. And activities related to the National Days of Prayer will be held at the community level as a result of reduced access associated with the passage of Tropical Storm Erica. The intention originally was to consider having a big get-together, but because of the challenges and the safety issues, we felt that it would be better to have it in our respective communities, at our respective churches. A National Day message of prayer from the government shall be read at all churches on the respective days. These declarations are intended to honor lives lost, as well as to offer thanksgiving to the Almighty God. I just want to draw to your attention aspects of the preliminary assessment of damage caused by Tropical Storm Erica. As you would have seen in footage and coverage, quite a number of families have been displaced, and therefore washed away, destroyed, damaged, and some have to be abandoned. It is estimated that in Piditsavan, for example, you're talking about 217. The other parts of the country, 154 so far. A more detailed assessment is being done, and when we look at the actual cost of the damage on persons' dwellings, you would have recognized, because of the extent of the destruction on Piditsavan, and having had to take the decision to evacuate the entire village, discussions would have to be ensured in respect to how do you address the issues of construction of homes and the associated facilities, schools and health clinics, and all of these playing facilities will have to be taken into consideration. And also the smaller hamlet and village of Jubik was also evacuated, and many of the residents here whom we have been in contact with have indicated that they will not want to go back. And their views are consistent with the views of the government. But of course, in these situations, the state must engage those affected and have an appreciation from them of the concerns and how we can move together towards addressing them. All I will say is to provide for these people. We have, I believe, a moral obligation to ensure that we can take care of those who've been dramatically affected. Of course, you have known that the many hotel plants have been affected. One in particular, the Jungle Bay, was dramatically affected. Several of the cottages were literally washed away by landslides, displaced by earth movement. And in speaking directly to the proprietor, he has indicated that that site would have to be abandoned and a new site found for the construction of a new hotel. So one can understand the extent of the impact on tourism and the impact on the way of life for many people. And there are many tourism sites. Many tourism sites and other hotels have suffered serious damage. The airport has been impacted on heavily. The preliminary estimated cost to bring the airport back to operation would be in the region of $39.5 million. That is what will be required to bring the airport back. Every piece of equipment at the hospital, at the airport, has been destroyed beyond use, and therefore every piece of equipment would have to be replaced. That's the preliminary estimate. With regards to the infrastructure, the report from the Ministry of Public Works, the estimate, and we're talking about just roads and bridges, justice. It doesn't include homes. It doesn't include, reconstruction of the roads in Piditsavan and other communities like that. You're talking about some of the main roads and main village roads. The estimate which has been provided by the Ministry of Works is in the tune of $612,700,000. So $612,700,000. And as I said, that do not include the resettlement of several families and the attendant cost associated with that exercise. This is going to be a huge undertaking. It's going to be an expansive undertaking in order to restore the infrastructure. So while we have, and of course, just to clean up, is estimated at $12 million, just to remove the landslides and to cause there to be emergency temporary the other point I would like to, and of course with regards to agriculture, the Ministry of Agriculture in collaboration with ICA are continuing the assessment, obviously with limited access to many communities. There were some difficulties in getting into those areas. For example, in Dalis and in Whitaker, those areas were difficult to get into because of the challenges of the roads in those communities. And of course, priority was given to relief efforts, search and rescue, so that those teams would not have been airlifted by a helicopter to do the surveys. With regards to the impact on the infrastructure, we have a team here from the World Bank. The government invited the World Bank here, and they have been around here since Monday morning doing the assessment around the country, and they too will prepare an independent assessment of the cost of the infrastructure of Tropical Storm Erica. Just to say that finally, and before I allow the more important people to speak on some issues, I just want to place on record that as we've done with all the friends and development partners and benefactors who've been assisting us thus far, I want to place on record our gratitude to the government of the United Kingdom for the presence of the military vessel with 150 men and women on board. And the entire 150, the entire crew, the British have indicated to us, is available to assist us. They have been deployed to Jubla, so they'll be based out at sea in Jubla, posting at Jubla, and then they have been deployed to assist in and other communities and dailies, but Collier and Collier Street have been heavily impacted upon. And also there was one death, I believe, in one person missing, in Collier, and there were persons affected in Collier Street. The British personnel, they will also assist with relief efforts, and they will assist also with the establishment of some temporary water systems. In some parts of some villages, the water systems have been heavily compromised. So the British have indicated that they have the capacity to assist us with temporary water systems. So I believe they'll be doing one in Marigot, Wesley, and also assist us with the treatment of so Woodford and Wesley, Marigot, and also be assisting us with treatment of water systems. They're looking at many other aspects where they have the competencies to assist us. So we really want to say or use gratitude to the British. So we're hopeful that with their involvement, the involvement of the British, other developed countries will also come on board, as there is plenty to be done, as this country honestly does not have to rebuild this country to the state it was on the day before the passage of Tropical Storm Erica. But let it be known very clearly that we're not passing around a begging bowl. We're merely saying that this country has suffered a major setback and it needs the immediate help of friends and well-wishers. It's going to take a lot of effort on the part of the country to restore the infrastructure. The East Coast has been severely battered, and these are some of the things that we've been saying to some of our development partners with regards to the impact of climate change on our small islands, the devastation that it can cause, and set back a country many decades. So I will end here, but just to say that the task is going to be a challenging one to address the issue of infrastructure, the impact on the economy, the impact on the GDP. There's some things that the country has to do for itself and by itself, and and therefore we will have to contract loans. I'm hoping at highly concessionary rates. I'm pleading for 0% interest loans and maybe 20-year grace period, and maybe a 40 or 50-year repayment on the principal. So these are the kind of loans that we would like to see from our partners to help us in quick time to restore the hope and confidence in our people. I will end here, and I will pass on to, you will have an opportunity to ask many questions, but I would like to pass on and move aside in conspicuous seat so that the PS can take over. PS, please. Thank you.
Good evening to everybody. Special good evening to the Honorable Prime Minister, Honorable Roosevelt Skerrit, the Honorable Minister for Planning, Economic Development and Investment, Dr. Colin McIntyre, our own staff, our Chief Medical Officer, Hospital Medical Director, Director of the Secretary to the press, listening and viewing public, good evening. I must say that I'm very delighted to be able to chair this important forum with a special emphasis on health. And I really need to thank the Honorable Prime Minister for having given us this opportunity. I wish also, even before making it, the Ministry of Health's sincere gratitude to the Honorable Minister for Health, Dr. Kenneth Daru, who would have liked to be here with us tonight, but because of unsinful circumstances is unable to be there. We also want to applaud him for his heroic efforts in performing in several roles, that of parliamentary representative, minister, and more so as our medical doctor on site post Erica. Also to the team in Grand Bay who have been very resilient, our own corps managers who, even in the absence of the permanent secretary and the minister who was stranded, they ably coordinated the first response. So we really want to thank them, and all the other health professionals who have really been working relentlessly to ensure that we get our services restored. I would want to say that although we know it is normally said that the events of catastrophic nature, usually the effects could be minimized or mitigated if you maybe take early actions and preemptive actions are taken to address maybe the effects of disaster. But for us, especially in the event of Erica, although we had a very well-structured plan, the timing wasn't there to even activate the pre-disaster component of the plan. So we actually realized that we would have a very wide impact because of our inability to really respond effectively pre the Ministry of Health and the Environment. As part of our first response, what we did was to activate our Health Emergency Operating Center. And this is situated at the refurbished APU building at the hospital. And what we have done is every day we meet at 3 o'clock with key stakeholders to provide feedback and to review our actions as it relates to issues relating to Erica. And the CPO and CMO and the CPS will speak as to what happens during those times. We also would want to mention that although it has been an overwhelming situation, that we have been getting also overwhelming support. And I think that was our own country program specialist, Mrs. Augustine, and the government of Dominica, and our senior staff who very early we started coordinating the efforts to ensure help, and PAHO has responded effectively, and so too has the Cuban government and the Venezuelan government, and we have been assisted greatly in many ways, both in the provision of human resource and medical supplies. And as I said, we have a team tonight, so CMO will speak to what has been happening on the ground. Now, we would have not been able to respond in the way that we are responding now without this help. As you realize, with regional stakeholders like PAHO, they have access that we, maybe Dominica, do not have. These resources that we would need in Dominica, they are not available. But the regional organization like PAHO, they are able to access these additional resources, and these resources can help augment the local services that are presently available. And we want to put on record, CPS, our gratitude to the Pan American Health Organization for that very first response. And as we speak, we have a team of persons from the World Health Organization PAHO office in Barbados with us. They're providing training and providing technical expertise, which is assisting us in our response. We also would want to place on our record the overwhelming support from our own local persons who live overseas, our nurses. As we speak today, we had a team of 6 persons from the BVI, and they are Dominican nurses who have paid their way at no cost to us, and they will be here to work alongside our staff. We want to thank them. We also have gotten the support from our retirees in various fields. They are with us in different areas and providing much needed support. So in going forward this evening, we intend to follow this format. The Chief Medical Officer will provide you a situational analysis of our public health response, what is happening in the EOC, the public health response, implications of the consequences of Erica. The HMD will provide us with the hospital response as it relates to staffing, the medical supplies, and anything as it relates to what happens at PMH. Our Director of Primary Health Care healthcare response. She will also give a status on our facilities in the primary healthcare. An update as to the operations of these centers. She will also give you a status report on the assessment on the various shelters, that is in reference to the health aspect of the persons in this shelter. And our country program specialist will provide you an update as to PAHO's response and interventions with us as a ministry. At this time, I will ask the Chief Medical Officer to make his intervention.
Thank you very much, P.S. Roy, Honorable Prime Minister. First of all, I never thought that I would ever be sitting in a seat that the Prime Minister is sitting in, so only under disaster circumstances. Honorable Prime Minister, Honorable John McIntyre, the Press Secretary, our PAHO country program specialist, Dr. Blah, our hospital medical director, our director of primary health care, other PSs, Mr. Later, and ODM director. Good evening. And good evening to the listening public out there. Good evening to our Honorable Minister of Health, who maybe is listening to this press conference at this time. Since the passage of Tropical Storm Erica, the Ministry of Health has activated its emergency response plan. One of the things that I would like to reassure the general public is that we are operating. We have done a quick assessment in terms of our healthcare facilities, and the details of those healthcare facilities in terms of how operational they are will be provided by the Director of Primary Healthcare. But just to say from start that our main hospital was not directly affected, so our main hospital is fully functional, have been affected. We were able to do as well a rapid assessment in terms of our staff, which ones of our staff that were directly affected by the passage of the storm. And based on that assessment, we were able to come up with a needs assessment in terms of requesting for additional support outside of Dominica. In terms of our response, a lot of our response are focused in terms of the areas in which have been identified as the special disaster areas, as indicated by the Prime Minister. Those areas which involve Bath Estate, Paradise Valley, Pidissavan, Campbell, Pishley, Pidissophia, Good Hope, San Sever. We have gotten a number of assistance in terms of regional assistance to complement the staff that we have in Dominica to assist us. We have gotten assistance from Cuba. We have on island additional anesthesiologists, pathologists, several other nurses from different countries, and Dr. Blah will speak to the details of those. One of the things that we have done is to determine what exactly the quantity of medical supplies that we have on island in terms of our drugs and medical supply, and based on that we came up with a list which was immediately submitted. I must say that immediately after having submitted that list, we were able to get a lot of the medications in terms of life-saving medications which we didn't have on island to complement what we have in Dominica. We have a significant amount of medical supplies that are currently coming in. We are taking an inventory of those. As soon as these supplies come in, we're ensuring that these supplies are distributed urgently to the communities in which they are needed. In terms of our response as well, we have activated a surveillance system have been activated. We are monitoring what is happening in the community in terms of diseases, in terms of injuries, in terms of our water and sanitation and our vector-borne diseases. Part of the Ministry of Health response is the whole question of emotional and psychological support for the persons who have been directly affected by the storm, and that is ongoing as we speak. Some of the concerns that we have in terms of following the storm, in terms of waterborne diseases, particularly gastroenteritis, and our director will speak specifically in terms of some of the do's and don'ts in ensuring that persons do not get waterborne diseases. We also have concerns in terms of vector-borne diseases such as leptospirosis spread by rats and other types of animals. And again, the director will pay special attention in terms of some of the things that we need to do to address that. We have, as part of our response, mindful of our patients, and we have immediately done what you call categorize our patients in terms of some high-risk patients. So we have identified patients who are high risk in terms of our patients whose condition may be compromised if they do not seek medical attention within 24 hours, such as our dialysis patients who are dialyzed 2 to 3 times, sometimes 3 times a week, our diabetic, our hypertensive patients with heart diseases, and we have a plan in terms of addressing it. So in a nutshell, just to say that the healthcare service is functioning with some limitation. We are supplying medication and other essential medical supplies to the communities. We are getting an outpouring of donations, and one of the things that we have set up a policy in terms of what type of donations that we're expecting. We're expecting persons in the regional international communities that are in supplying medication or drug supplies to Dominica will be mindful in terms of the type of drugs that we are requesting, the expiry date of those drugs that we are requesting. I want to say that in terms of our response, we, as Pierre said, we have set up a health emergency operating center at the Princess Margaret Hospital. We report on a real-time basis to our representative that is present on a 24-hour basis operating at the National Emergency Operating Center, and we get feedback, and based on those feedback, we modify our response. Thank you very much.
Good night, everyone. I would like to recognize the Prime Minister, Mr. McIntyre, other distinguished ladies and gentlemen, my Ministry of Health colleagues. I would like to start off by extending condolences to all those who've lost loved ones as a result of the passage of Tropical Storm Erica. And would also like to remember as well and keep in our thoughts those who've lost property and who have otherwise been displaced by the passage of the tropical storm. Now, with regards to the response of the Princess Margaret Hospital to the passage of the storm, the first thing we did was to adjust our operations, and that included the cancellation of non-emergency or elective type services. So that would include things like surgeries that were not urgent, as well as outpatient clinics. And these were cancelled so as to allow freeing up of resources, both human and otherwise, to deal with urgent situations. We do hope, though, that by next week we can resume or move towards resumption of normal activities, going back to regular surgical lists and regular outpatient clinics. The hospital also provided support to our primary healthcare colleagues by deploying some of the doctors who are actually stationed at the hospital to some of the out districts. As you would have been aware, a number of the health centers, the out districts, were not able to access the hospital, and as a result, the workload in those areas would have been significantly increased. And so we felt it was extremely important that we provided additional support and medical personnel. So doctors were deployed to those various health centers. The hospital and the central medical stores continue to work very closely with the primary health care services, the various health centers, in ensuring that supplies, medical supplies of wide range medications, etc., are sent on a very regular basis and as is needed to the various health centers. So we're making sure that things do not run out in the districts. We've also made some provisions for patients who are high risk to allow them to be on the hospital compound, and we speak specifically of the dialysis patients. As Dr. Johnson alluded, we have patients who are dialyzed up to 3 times a week, and it would have been extremely difficult and probably impossible for them to keep going back and forth, again because our road network has been so significantly interrupted. With special circumstances, we of course have special demands on staffing, and we are very pleased to inform that we have a pathologist from Grenada. Services were very willingly offered to help us with our pathology department, in particular the postmortems that we have to do that are arising as a result of this disaster. We also had a group of Cuban volunteers coming in yesterday, and that included 6 family physicians. They're currently receiving orientation at the hospital, and we're hoping to deploy them to the district health centers to assist and work alongside the district medical officers. From Cuba, we also have an anesthesiologist who remains assigned to PMH, as well as an epidemiologist who is working with our national epidemiologist, Dr. Ricketts. We've had as well 7 nurses from Cuba who remain at PMH, and we also have 6 nurses who arrived today as well from the BVI, and they too will be deployed throughout the healthcare service. I must say, on a daily basis, we continue to have offers from literally all over, offers of both medical supplies as well as medical personnel, and we're constantly processing those offers so that we ensure that we keep up with the demands on the ground. And I would really like to use this opportunity to thank all our partners, and those are both old partners such as PAHO, as well as new partners. We've created a lot of new relationships since this disaster, for really coming on board and helping us as a ministry to continue to provide much needed service within the health sector.
Good evening. Good evening to the Honorable Prime Minister, Roosevelt Scarrett, to the Honorable Dr. McIntyre, other ministers, my Ministry of Health colleagues, the country program specialist for PAHO, members of the National Emergency Operations Center, the media, guests, and the listening public. On behalf of the primary healthcare team, I wish to extend sympathies to those who have lost their loved ones and properties, and to emphasize with all fellow Dominicans following the passage of Tropical Storm Erica. This evening, I'm going to focus on the essential components of primary healthcare services. As it relates to health centers, at present, most of our health centers are fully operational. Presently, the Dalis and Boetica health centers are not accessible via public transportation. However, there is a resident nurse in Dalis and a health team, including a doctor, who is being airlifted to provide services to those communities. The Bells Health Center, on the other hand, is not accessible, and no healthcare services are being provided there at this time. Healthcare services for Kulibistri is now being provided for at the Roman Catholic Church Presbytery. As it relates to medication, persons suffering from non-communicable diseases such as diabetes, high blood pressure, and asthma should visit their healthcare center that is closest to them in the event of any emergencies. We encourage you to take your medication as was prescribed by your doctor. If your medication is finished, lost, or got wet during the storm, please report to the health center that is closest to you for a refill. Persons on insulin are all advised to keep your insulin in a cool area. It can remain at room temperature or in a cooler with ice if possible. As it relates to medical supplies in large quantities have been and continue to be distributed to all health districts via different mediums, by land, air, and sea. As it relates to shelters, presently there are about 6 shelters open to accommodate persons who have been evacuated from their homes. The shelter housing the most persons is at the Dominica Grammar School. Due to its close proximity to the Roseau Health Center, much of the needs of persons are being cared for there. However, nurses have set up a health post at the Dominica Grammar School where medical and counseling services are being provided for by the team. Plans are underway to expand these services. As a measure of preventative measures, so to speak, as it relates to water, until further notice, all drinking water should be boiled or treated using water purification tablets. And the environmental health arm of the Ministry of Health is now distributing these tablets. For persons who can see, this is an example of our water purification tablets. This is Aqua Tabs. Each packet contains about 11, I think, about 11 tablets. So as a mode of preparation, there are 11, 2, 4, 6, 8, 10, 10 tablets. So as a mode of preparation, we're asking that you take 1 tablet and add it to 1 liter of water. 1 tablet to 1 liter of water. Now I have my bottle here with me. This is half a liter. So if I want to purify this water to make it drinkable, to 2 bottles of this, to 2 bottles, I would have to add 1 tablet. So 1 liter equal 1 tablet. Now, as it relates to this, everybody's wondering what I'm doing with this big bag. This is a bleach bottle, or I think we call it, well, it's a gallon bottle. We normally call it, there's a term we use. Jerry can, that's right. And it has a 4 liter capacity. So essentially what you do, you put 4 tablets into this container, you leave it stand for 30 minutes, and then it's ready to drink. All right, in addition to that, we want to avoid purchasing local juices if you are unsure of the quality of the water that is being used to prepare those juices. In order to prevent the breeding of mosquitoes, you are to store your water in clean, covered containers. This will help prevent diseases such as dengue and chikungunya. As it relates to hand washing, in areas that still do not have water, or where your sewage have been affected, attention must be paid to proper disposal of human waste, followed by hand washing. Hand washing is absolutely necessary at this time. In the absence of running water, please avoid washing your hands in basins. Rather, pour water onto your hands for washing. In the absence of water, you can use hand sanitizers. However, please remember that hand washing with soap and water is more effective than using hand sanitizers. As it relates to garbage disposal, please avoid littering and careless dumping of garbage to prevent vector-borne diseases such as leptospirosis and gastroenteritis that is caused by flies, rats, and other rodents. As it relates to dust, we recognize that there is a lot of dust in the affected communities. Please use a face mask when traveling through dusty areas. In the absence of a face mask, you can use a wet handkerchief. However, avoid dusty areas as much as possible. Please note that special attention must be placed on our most vulnerable populations, including our children, pregnant females, and the elderly, ensuring that their health is not compromised. So in summary, these are the take-home messages or the key points. Number 1, ensure your drinking water is safe. 2, that your hands are kept clean. 3, ensure proper human waste and garbage disposal. And 4, that your health services are available in all communities. The Ministry of Health has set up a hotline that you can call at any time for information or if you have questions. This number is 448-2151. Again, the number is 448-2151. At this time, we are indeed faced with challenges in one form or another in all districts around the island, but we are resolute in the fact that we will recover. Remember, you cannot be careless. Your health is your responsibility. Thank you.
Good evening, everyone. I wish to acknowledge the Honorable Prime Minister, Honorable Roosevelt Skerrit, Honorable John McIntyre, all the distinguished heads of department, Ministry of Health team, the press. Good evening. PAHO is here to support the Ministry of Health in its health response to Tropical Storm Erica. We have been supporting the Ministry of Health in managing information and coordination of the Health Emergency Operations Center. At the time of the storm, PAHO already had 2 engineers stationed in Dominica. They were working on the assessment for the Smart Hospitals project, as well as a consultant who was completing the vulnerability assessment for climate change. So we already had these people in Dominica. On Saturday evening, the first team arrived from PAHO. They arrived by the Coast Guard vessel, the St. Lucia Coast Guard vessel, along with the CMO who was also in St. Lucia at the time, and they arrived with supplies. And a health disaster specialist came down on that vessel along with an environmental health specialist. And they have been doing a lot of work since they have been here. A donor proposal was developed for response and recovery operations, as well as a list of supplies and logistic needs was developed. On Monday, we were joined by a PAHO supply management consultant. He arrived and he hit the ground running. He trained 12 persons on Monday. These persons were selected by the National Emergency Operations Center. He trained them in using a specific software for logistics. The following day, he trained 28 persons selected by the NEOC, and he also trained 8 persons at the central medical stores and evaluated the temporary medical storage options. The engineer and architect completed in-depth assessment of Rosa Health Center, while the advisor on environmental health met with environmental health teams to highlight areas which should be focused on and verify the hospital water provision. The disaster specialists met and coordinated with agencies such as OFDA, World Bank, and UNOPS. We have also assessed the public health issues at the Roseau Grammar School, Bath Estate Primary School, and Roseau Health Center. Today, September 2nd, a PAHO water engineer arrived to support the WASCO, and he also arrived with supplies from Barbados, in PAHO Barbados, including 20 radios, which we were waiting for a long time. PAHO is also helping to support a team of nurses coming in for some of the islands. So PAHO remains committed to helping the disaster relief effort in Dominica, and we are glad to be part of what is happening, and we stand ready and willing to help in any way possible. Tomorrow, our PAHO WHO representative, Dr. Schweb, is expected on island along with a team from the UN. Thank you very much.
Okay, thank you very much to all of our panelists. I think they have done a great job in providing a synopsis of the interventions of the Ministry of Health. And at this time, I do not know if you have any questions for us, the Ministry of Health. So you can go ahead.
Yeah, my first question will be for Dr. David Johnson. Yes, Dr. Johnson, given the situation in Dominica right now, what are some of the diseases that the Ministry of Health may be looking at, or the diseases that we are exposed to at this moment?
Thank you, Curtis. I knew the first question would have come from Curtis Matthew. But before I answer the question, maybe I should just inform in terms of, as a direct result of the storm, what are some of the health problems that we are seeing, or we have seen at our main hospital a total of 63 patients. We hospitalized 11 of those patients and discharged 44 of those patients. The main type of injuries that we have seen so far are mainly fracture of your limbs, lacerations, different parts of the body, some crush injuries, and also wounds, puncture wounds. In terms of your direct question, we have sort of addressed that issue. So we are concerned in terms of our waterborne disease. We know that there's a scarcity of water on the island, and particularly some communities are more affected than others. So there are some diseases that are waterborne diseases, and this can give gastroenteritis, vomiting, diarrhea. So we are concerned in terms of those diseases that are spread by water. We are also concerned, and Dr. Esprit, our Director of Primary Health Care, has addressed us in terms of some of the things you can do to ensure that your water is safe. We also concerned in terms of vector-borne diseases. We have recent experience of what happened in terms of mosquito, the Aedes aegypti mosquito. Chikungunya has devastated Dominica. Dengue is also endemic to Dominica, so we are concerned in terms of because of increased storage of water, and we know that a lot of the times the mosquito breed in these containers, the drums, etc. And so we are concerned about the dengue. We are also concerned in terms of, because a number of persons might be injured, getting lacerations and probably walking barefooted, they have to, because of the difficulty in getting from one coming to the other, passing through dirty water that is infected with the urine or feces of things like rats, that persons would be exposed to leptospirosis. So in a nutshell, these are the main diseases that we are concerned with. These are the diseases that we're working hard in terms of preventing an outbreak, because we do not want this to occur in Dominica at this time, and we're working feverishly in terms of preventing those sort of diseases. I hope I answered your question, Curtis.
I'm not sure who is the best person, so I will just close it and whoever will respond. In terms of the Dominica Grammar School, I think Dr. Laura Esprit indicated that it's the largest shelter. She didn't indicate how many persons are there, but she said it's the largest shelter. So are there any specific measures in place for dealing with any diseases or outbreak that might occur?
Number 107 at the grammar school.
Grammar school.
They took away national number, or does
the national
Grammar
knowledge.
grammar school interested in?
She just said that it's the largest shelter.
Oh, okay, it's 107.
Oh, okay.
You want to respond to her question? She asked about what is being done. I think you spoke about it already, the assignment of staff.
All right, so essentially what I said was that it was the shelter that was accommodating the most persons. So I was really focusing on numbers and not necessarily the size of the structure. All right, but okay, thanks. But as to what is being done, I think just to reiterate, because of the proximity of the shelter to our healthcare facility, we are not necessarily going to move across. However, we have allocated one of the rooms where a nurse, we have a schedule that is already put together. A nurse will be physically there to deal with the medical and of course referrals for the counseling aspect of it. There is also a team, and the plans are on the way to actually have a morning and an afternoon shift, afternoon/evening shift at the Roseau Health Center, so that a doctor is made available to these persons in the event of an emergency. So that is our plan. Today we've actually started with a clinic in such that persons who may have lost their books, who do not have medication, whose medication got wet, who needs dressings, who have any form of lacerations, who need some form of first-time assessment, they were being seen. So high consideration is made for that group of persons.
Yes, Dr. Cesar, while you are at the mic, I just have a text message from someone who's asking, the communities who is receiving water from pipes now, is that water safe to drink right now? So, if you want to hear the question again, the communities getting water over the last day or two, is that water, can we drink that water right now?
I would suggest that we do not drink that water. What I'm suggesting or what we are recommending is that the water be boiled, or if we have water purification tablets, we do that. But as I said, the Ministry of Health, particularly the environmental health team, are distributing those tablets.
In all the health districts.
In all the health districts. So at this point, we should not consume the pipe-borne water.
Are you aware that people are drinking the water right now?
Well,
we have sent out information. Can I speak to that? I must say that even prior to the hurricane, that the Ministry of Health through the Health Promotion Unit had already provided information on the purification and boiling of water. We actually had an ad where we taught people how to do the bleach, using bleach to ensure that they have proper water. And one of the things that we need, I think most of the district, the response that we have been getting is that most of the areas have already received the purification tablets. But in the absence of that, let us go back to the basics, ensure that you boil your water before drinking. Any other questions?
I'm not sure if it's already done.
If I may, Dr. Esper did an excellent job in terms of saying, because I know that there is concern in terms of what's going on at the shelters, and although she spoke about the DJS, we also monitor it and have a presence in the other shelters, Bath Estate, Montrachet, Granby, and Granby as well. Apart from what Dr. Esper said in terms of ensuring that we have the physical presence of nurses and doctors, we have to augment that in terms of the actual presence of these doctors and nurses at the shelters that are most affected, particularly the shelters from persons coming from Petit Sudan. I mean, that is a concern for us, so we're attending to that. But apart from the nurses and doctors, we are going to step up in terms of the mental health response. We're in a meeting with the Prime Minister earlier today, and that point came home very, 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 very vivid to us in terms of the need to step up the response there. Persons have lost loved ones. Persons have been searching for their loved ones, and we need to provide increased emotional and psychological support to these individuals. And the Ministry of Health recognizes, but it needs to augment that. There is a team that set up at the national level. We have 2 psychiatrists at the hospital. One was out, the other came in today. They are going to be meeting with the team that already established tomorrow morning with all of the sectors, and to ensure that on a daily basis that we provide this kind of psychological and emotional support to those persons. It is absolutely critical, not just giving medication, not just giving tablets, but emotional and psychological support. So we are committed to that, and that is going to be improved. Curtis.
Okay. And just to re-emphasize, this is the leaflet on the making your water safe that was sent before, but if you have not gotten a copy, it is available at the Health Promotion Resource Center at the Ministry of Health. Okay. All this, and it's at all the health centers also. Okay.
We've mentioned several the two offshore medical schools, Ross and also the university, or have they already come into place?
You can speak to that.
The Ross University is a partner for the is a key partner of the Ministry of Health and has been so for the last 3 decades. We have our needs are continuously being reviewed. Ross is always willing and ready to participate in any activity that the Ministry of Health has, and it's a dynamic process. But we are in the process of contacting Ross in terms of assisting us in providing that sort of coverage based on the need that we have and based on the availability of the human resources. So in a nutshell, yes, the Ministry of Health will be working alongside Ross University and the two offshore schools in terms of their capacity and the need of the Ministry of Health, or the need of Dominica in terms of the public health response, yes.
Dr. Johnson, you mentioned that people have lost loved ones. I know the question has been asked a few times. Do you have the numbers? People are still asking.
Temporary. Let us be clear on one thing. There is certain information. We have to be transparent in the information that we give, but we also have to manage the information, and the person responsible. This is a national crisis, and therefore, so under normal circumstances, you'll ask me certain question in terms of numbers. My response, until I'm directed by the Honorable Prime Minister to give us certain specific numbers. I prefer that he does that. The information will be given to him, and he will make that announcement known to the nation and to the general international community.
I'll pose the question to him, sir. Thank you.
Yes, sir.
Thank you. I want to thank the health team profusely for the extraordinary effort which you've been making. I must say that members of the health team are really on a 24-hour work program, and I really want to thank them because their work, their job, their task, we have to ensure that we are there to provide the healthcare services to our citizens. At a time when anxiety is high, emotional distress that can trigger, as I understand it, prevailing health conditions and cause a pain than otherwise. But we will ensure that of our citizens and to share the information to the rest of the public. They provide created access to almost all the communities, you know, as I said, with the exception of a few. But that is just temporary emergency clearing. We continue to ask motorists to be very cautious and careful. There's no need to speed, there's no need to race. In the Makushri, Battley area, you know, be very careful, and the Layo area, how you travel those areas, while there's access, you know, it is not completely safe. Those of us who be driving motor cars, you know, you should not really be trying to cross the Battley and the Makushri areas and so on. Yes, ma'am.
Yes, just one more question. Esther from the Barbados Government Information Service.
Sure.
Just wanted to find out in which way is the contingent from Barbados being used, and how is the Barbados government assisting in the efforts?
The contingent from Barbados has been very helpful. They've been involved in the evacuation exercise. We use their personnel and also the vessel to help transport the evacuees from Savan, from Scottsdale area into the city. The men have been used in different aspects of the recovery effort. So I consider that they've been extremely helpful. They've given some added hands to the already stretched police force of Dominica. Because, as you know, the police is engaged in a number of activities, search and rescue, ensuring that there's security for the areas affected and for the whole country. And so the Barbados government have been very helpful in that regard, in terms of its immediate assistance in the search and rescue effort. Obviously, in the longer run, in terms of reconstruction, then we will look at this. The community of Barbados have also been very helpful in sending supplies to us from various groups and individuals and business houses. We've had one of a boat come in here free of charge to bring in the supplies. There's a second boat coming from Barbados, I believe, tomorrow. They are coming from Barbados with supplies and then going down to St. Vincent to pick up some Bailey bridges for us, because we're seeking to erect a couple of Bailey bridges as quickly as possible. Temporary bridges, but nonetheless much safer than what we know we utilized especially on the west coast of Dominica. But so they've been very helpful. I've been in touch with the Prime Minister of Barbados on a number of occasions and other parliamentarians there.
Also, Barbadians would like to know how else can they assist? What do they need, and how do they get the donations to Dominica?
Well, you know, we are in communication with them. The Dominica Association in Barbados are also having an activity on Saturday, and I will have the opportunity to speak to them then. It's a live event, but there are a number of areas that we have communicated that to the relevant authorities there. Okay. I want to thank all of you. A question, please, yes.
Yes, Mr. Stern, there are a number of figures going around on the social media, internet, in terms of the actual death toll. What is the official confirmed toll in terms of this?
We could say, let's put it this way, the total number of people missing is 35, right? 35. The actual number of corpse or bodies we have recovered is 11. And I believe 20 out of the 15, out of the 35, sorry, would have been in the Savan community. And we have been able to recover from Savan five bodies, six bodies from Savan. So in Savan, we still have 14 people missing. In Barfay State, for example, we have 2 people missing. They were washed away by the river. They have not been located. So 35 missing, 11 bodies have been located, and 20 out of 35 missing are from Savan. But you know, as the CMO rightly said, this is a very sensitive and delicate situation where, you know, when people are missing, you know, so it's always a difficult subject for all of us, and for the families who are grieving. Okay, thank you, all of you. Good night to you, and God bless you. Thank you.
Thank you, Leanne. Thank you.